Hi everyone, welcome back. So in this video I am going to be talking about sacroiliac pain or sacroiliitis, which is basically pain and inflammation in this sacral area just here. So basically, because of the rise in sedentary lifestyles, which causes increased tension in those lower back muscles due to prolonged periods of sitting, sometimes, this can compress nerves. It's probably now estimated that about 10 to 25% of people with lower back pain actually have something called sacroiliitis. Now, sacral pain can also be caused by prolonged periods of standing. And you may find, if you're like me and have a long history of sort of problems with your back, actually that's one of the reasons why I gave up theatre nursing, was because standing in the one position, my back couldn't take it, it just seized up. So it's not just, prolonged sitting. So what is sacroiliitis? Well, it's basically inflammation of one or both of the sacroiliac joints. So now if you imagine on a skeleton, when you look at the spine, down at the bottom of the spine there's a sort of a triangular shaped bone which has about 5 bones all fused together, and that's the sacrum bone, and it connects with the ilium, which are the rounded bones on the back of the pelvic bone. And so where that triangular bone meets the ilium, that is the sacroiliac joint. Now, so sacroiliitis, it basically causes lower back pain, but this pain may also extend down into the buttocks or even down one or both legs. And the problem is diagnosis can be quite difficult, and this is because there are a lot of other inflammatory conditions that can cause pain in the same area. Sacroiliitis has been linked to arthritis of the spine, and it's also been known to be misdiagnosed as a slipped disc. Another reason for the difficulty in diagnosis is that the lower back has extensive musculature involved in postural stability, flexion and extension, and some of this may kind of refer pain away from the sacral area and make you think that the problem is actually somewhere else. So that's why diagnosis can be difficult. Now, if we look at the anatomy, so as we've said, the sacrum is that triangular bone of the lower spine that sits between the two hip bones, those iliac crests that you see, the big rounded bones on the back of the pelvis. It consists of 5 fused pieces of bone. As we've said, forms part of the pelvic girdle and therefore helps to protect internal organs, some abdominal and certainly the pelvic organs. The sacrum also has, which you'll see if you look on a skeleton, 4 holes on either side of that triangular bone, and these are there to basically allow nerves and blood vessels to pass through and sort of hopefully without getting compressed. The sacrum works alongside the gluteal muscles and the hip flexors on the front, to assist with leg movement, whether that be, flexion at the hip or bringing the leg out to the side, whatever. And it also, as we know, helps to provide space to allow for the passage of the fetus during childbirth. We know that when you go through the labour process, the position of the sacrum actually kind of opens up to allow baby's head to, drop down. So in terms of causes of sacroiliac pain, we have arthritic causes and non-arthritic causes. So the non-arthritic will be things like trauma or repeated injury to either the sacroiliac joint or, sort of anything that causes tension or laxity in the ligaments, which again, it's why you get sacroiliac dysfunction in pregnancy, because the effects of the hormones, you get a lot of ligament laxity where they're stretching to support the, growing fetus. Or it could be, if there's spasms in the sacrococcygeal muscles, which are the ones that attach the sacral bone onto the sort of the tailbone. And this can happen due to an impact that maybe forces the bones into an unusual position, or the muscles more so into an unusual position. So things like stepping awkwardly on a stair, or maybe having a fall, or being in a car accident. As we've mentioned, pregnancy can certainly cause some sacroiliac issues. As I've said, the relaxin and the progesterone hormones, they relax the pelvic muscles and ligaments to accommodate the, growing fetus and labour. But occasionally, this laxity in the ligaments can cause pain due to the sacroiliac joint slipping out of place. The weight of the pregnancy, altered posture are also going to place additional stress on the ligaments, on top of this sort of hormonal effect. Another non-arthritic cause is external endometriosis. So this is basically where endometrial tissue will migrate outside the uterus. Potentially, it can, you can end up with the endometriotic lesions on the sacrouterine ligaments, and also behind the cervix. So these can also, cause some pain down around the sacral area. And if you've got endometriosis, do take a look at my previous video, which talks about that in a lot more detail and how massage can help. And then another cause would be any sort of sustained physical activity. So continuous physical workout, can certainly strain the lower back muscles and can also shrink the rectal uterine ligaments as well. And as we've already said, tension in the ligaments can cause pain around this area. Infection as well, any introduction of pyogenic microorganisms into the sacroiliac joint, whether that be due to a skin infection or probably more commonly a urinary tract infection, again, that can cause pain and inflammation. And then also things like if there's any kind of spinal abnormality, this can be congenital or acquired. It may arise quite often during spinal development in the womb. Usually it happens in that lumbosacral, area, causing sudden pain if a load is exerted on the spine. that's how, you know, you can often tell that there's some sort of abnormality there. Another cause is metabolic bone disease, so things like osteoporosis, osteomalacia, where, you know, there may be bone loss, which can then lead to injury and pain. Also, other maybe slightly less common causes, IV drug use is one. Also prostate conditions, so if there is chronic prostatitis or maybe prostate cancer with bony mets, this again is gonna, you know, likely sort of be causing pain around that sacral area. Mechanical stress as well, you know, if there are degenerative changes due to additional stress on a joint that's already compromised for whatever reason. So, for example, it may be compromised due to long-term arthritis, or maybe if someone's had a surgical spinal fusion, you know, then that again is going to cause, you know, long-term issues with pain. So they're the non-arthritic causes. Now let's take a look at the arthritic causes. So here we're looking at things like rheumatoid arthritis or any kind of rheumatological conditions, so things like lupus, also osteoarthritis. Wear and tear, you know, can occur in the sacroiliac joints and involve breakdown of those ligaments, and also the cartilage, but also advanced age, obesity, trauma, repetitive stress or postural misalignment, that all these things are going to worsen, you know, the arthritic condition, which can then consequently make the sacroiliac pain worse. Another one that I've seen a lot in practice is something called ankylosing spondylitis, which is a genetic inflammatory condition of the spine. Usually it originates actually in the sacroiliac joints before progressing up the spine, and this can cause inflammation, erosion, calcification of the bone. You've also got, maybe less commonly, psoriatic arthritis, which I've covered a little bit in my video that I did on psoriasis. But this is basically an inflammatory joint condition which causes scaly psoriasis and pain and inflammation of those spinal joints. And this occurs in roughly 10% of those with psoriasis. The other one is gout, which again is an inflammatory arthritis caused by uric acid crystals building up in the joints. If you've got this, there are actually some dietary things you can do, because certain foods will certainly increase this, you know, these crystal deposits in the joints. Okay, so now let's look at the symptoms of sacroiliitis. Certainly you can expect to experience a sharp or dull pain, generally in the buttocks and the lower back, but it can affect the legs, groin, and even in really bad cases right down to the feet. The pain, it may be on one side or both, but certainly that, you know, you would tend to find it will be aggravated by prolonged periods of sitting or standing. Also, you know, transitional movements, so getting out of a chair, getting in and out of a car, that sort of thing. You know, getting up out of bed in the morning, climbing stairs, If you are someone who tends to weight bear on one leg more than the other, mums are a classic example of this, where they're holding a toddler on their hip and they always kind of tend to stick to the same hip. Taking large strides, and also running. You runners out there are prone to quite a few different sports injuries, so this is one more. And also any sort of rotational hip movements as well can certainly make the pain worse. Another thing that you may experience is numbness or tingling or weakness in the leg, and when this arises, it's due to nerve compression, and usually it's compression of that sciatic nerve. And if you remember at the beginning, we said there's those 4 holes on either side of the sacral bone where the nerves pass through. The sciatic nerve, which is actually one of the biggest nerves in the body, is what, the main nerve that passes through that area. And that, if that's compressed, certainly you're going to get sciatic symptoms in the legs and possibly down to the feet. In terms of treatments, what can you do? So it's going to be influenced by what symptoms you have and by the cause of your sacroiliitis. Usually rest, medication, staying active is enough to resolve the pain. But if untreated, sacroiliitis can lead to chronic pain in other areas. And again, this is due to sort of overcompensation by other muscles. So, it is really important to get this treated as soon as possible. The usual things, rest, obviously may help reduce inflammation in the sacroiliac joints. Heat and ice, alternating heat and ice for the inflammation, heat to relax the muscle, ease the pain, and also to promote healing by stimulating the blood flow. Ice packs should only be used for 15 to 20 minutes at a time though, to avoid any kind of nerve damage. Sleeping. If you are someone who maybe sleeps on their back, you may find that this aggravates the condition, so possibly you might want to think about changing to a side sleeping position, and just using a pillow between the knees. You may find that eases pain overnight. Medication, the standard non-steroidal anti-inflammatories for pain relief. Certainly if there's any kind of bone weakness, so osteoporosis, osteomalacia, you may want to look at taking a vitamin D and calcium supplements. And certainly menopausal women are probably the ones to watch with that. But also muscle relaxants can certainly reduce any muscle spasms in the area. There has also been some research that has shown in cases where there's ankylosing spondylitis that tumour necrosis factor inhibitors may actually relieve the sacroiliitis. Other things you can do, you can wear a brace, just to help support the bone structure, kind of like a corset. I'd say more often than not people don't really bother with that, but it's an option. Really good treatment options, physiotherapy and massage therapy, and this is to strengthen and stabilize the muscles that support those sacroiliac joints and surround the pelvis, to improve range of motion and also ease the lower back pain, and just prevent any of those surrounding muscles from overcompensating and helping to correct any postural changes that may occur while you're accommodating for the pain. Hydrotherapy as well, another option may just help maintain flexibility without placing stress on the back muscles. Equally, swimming, good exercise, low impact. Now these are the sort of standard treatments. If they don't work, then you can speak to your doctor about the possibility of steroid injections, which can be injected directly into the SI joint to reduce inflammation and pain, but only in severe cases where other treatment hasn't worked, because for one, they're not very nice. And they can weaken the bones and the tendons, which is then going to cause you further problems. And it is a short-term solution. So, best to use, treatment options that will help you in the long term. Now, another thing that can be used to treat SI pain is something called radio frequency denervation. This, I can't really tell you an awful lot about this, but all I can tell you is that it can destroy the nerve tissue that is causing the pain. But again, this would be where conventional treatment hasn't worked. Another option is electrical stimulation. So by this I mean implanting an electrical stimulator into the sacrum, which may reduce pain. And then the final one is joint fusion. So fusing the two sacroiliac bones together with metal hardware can relieve sacroiliitis in rare cases. And we are talking, the real severe cases where nothing else works. But even then, it's not like certain that will relieve the pain. In terms of prevention, so either if you're just sort of looking at a sort of prevention method full stop, or if you've had sacroiliitis and you don't want it to come back, well, you can't really prevent it. You can improve recovery and you can try to reduce the symptoms. So when I say prevention, that's what I'm talking about. So this again is things like avoiding the activities that cause the pain, so whether that be running or climbing stairs. Try to lead a physically active lifestyle. And in terms of work, if you are finding you're in a job where you have prolonged periods of sitting or standing, you may want to talk to occupational health and look at modified working duties, even if it's just in the short term, just until you can sort of get pain free, and then work on other things like being active and all the rest of it. Certainly if you're in a job where you are doing a lot of lifting, do ensure that you have proper lifting technique, always bending at the knees, rather than just flexing at the hip, and then that causes your back to take all of the the stress. Ensure that you have a good sitting posture, and if you are in a job like a desk job where you're sitting down all day, maybe think about having one of those posture chairs. It's kind of a bit like a stool where you're sort of kneeling and it kind of tilts you forward so that it aligns your spine and pelvis correctly, and they're actually really, really comfortable, and they do make you sit up straight, so that's well worth looking into. Workplace ergonomics, making sure that the computer is in front of your eyes and that your feet are flat on the floor, and you're just not sort of straining to sort of keep reaching for anything. Nutrition, deficiencies, we know vitamin D, calcium can lead to chronic aches and issues with the bone. And as I think I mentioned earlier, if gout is also an issue for you, there are certain foods that actually can increase those gout symptoms. So I'd say if you have gout, you might want to consider a referral to a dietitian, or do your own research on the types of foods that increase these symptoms. Body mass index, obviously we talked about being physically active, and the fact that obesity can certainly worsen arthritis. It places, again, obesity, it places extra pressure on that sacral area, which is going to result in chronic lower back pain. And another one, a lot of you out there are probably going to hate me for saying this, but give up or reduce smoking. Smoking actually lessens the blood supply to the tissues, and the intervertebral discs naturally have a compromised blood supply anyway, so heavy smokers quite often are prone to back pain. So just try and reduce it, and you may find that helps. But so my job, how does massage help? Well, numerous muscles attached to the sacrum and the coccyx, that sort of assist with continence and various other reproductive functions. And so sacral pain may be due to postural strain or, some sort of muscular issue. Certainly the deep lateral rotators, hamstrings, hip flexors, these are muscles that you want to be sort of looking at if a client comes in. Also the pelvic floor muscles. All of these groups of muscles can cause, increased pressure around the buttocks. So they're the ones that, I'd be looking at if a client came in with sacral pain. By strengthening these supporting muscles, massage, as I've said, can help stabilise the sacroiliac joints and improve, range of motion in that area. By stretching out tight hip flexors, hamstrings, glutes, massage can ease lower back pain by releasing all that accumulated tension from prolonged sitting and standing. Now, in terms of exercises, there are a few that I'm going to recommend now, just basic stretches. So let's take a look at those. Now, moderate intensity exercises will certainly help maintain the flexibility of the spine. So the first one here is your basic quad stretch. So stand holding on something for support, bend the knee and use your hands to grab onto your foot and gently pull in towards the buttocks. Push forward at the hip slightly, so just at the front of the hip. On the same side to feel a stretch in the front of your thigh. Hold the position for 5 to 10 seconds and then release gently. And then repeat, maybe 5 to 10 times. Now the next exercise are these prone leg lifts. So laying on your stomach, you're going to use, these glute muscles and hamstrings all along the back here to raise your leg as far as possible up off the ground. Hold it and then slowly lower back down. And again, repeat this exercise a few times. And if your, SI pain is on both sides, then, repeat on the other side. Okay, the next one is this hip stretch. You're going to lay on your back and slide one foot as far as possible up the opposite leg, which at this point, this model's right leg is straight on the ground. You're going to slide the left leg, the left foot, up the straight leg as far as possible, externally rotating this hip and forming a figure 4 position. Then, to get a bigger stretch, you can then pull in under the thigh of the leg that has been straight and pull it up and pull it in towards your chest. Hold for a few seconds and then slide the foot back down. Now, by bringing this second leg up, you're actually getting a really good stretch in the deep lateral rotators. So we're talking about things like the piriformis muscle. You can then, repeat a few times a day. And again, repeat on both sides if your pain is on both sides. Okay, so the next one is this knee rotation. So you're going to lie on your back with your knees bent, feet flat on the floor, and just allow the knees to gently pull to the left, keeping the lower back into the floor. Hold for a few seconds and then return the knees to the center. Then you're going to repeat by just allowing the knees to gently pull across to the right. And repeat this 8 to 10 times, going just as far as you can, but always keeping the lower back into the floor. Okay, now this next one you'll be familiar with if you've seen any of my other videos. I use it quite a lot, and that's bridging. Those of you that do yoga will know this well. So you're going to lie on your back, knees bent, feet flat on the ground, and then you're going to squeeze your buttocks and raise the hips up off the ground, thrusting into the air. Keep the palms flat on the ground by your sides, and you're going to hold for about 5 seconds and then slowly lower yourself back down, and you can repeat this 8 to 10 times. Okay, another one that all you yoga lovers out there will be familiar with is the pose of a child. So on your hands and knees with buttocks resting on the heels there, you're going to extend your arms forward with palms facing down, and you're going to reach as far forward as you can. And then the final one is the bird dog pose. So this works the lower back and the abdominal muscles. Starting out on all fours, keeping the spine and the neck in a neutral position and looking down at the ground. Slowly extend your right leg behind you while in this picture it's our left. Slowly extend the leg behind you while simultaneously extending the opposite arm forward. While keeping your back straight, hold for 5 seconds and then repeat 5 to 10 times each side. Okay, so that is really sort of the basics on sacroiliac pain. If this is an issue for you, then certainly I would suggest also that you might want to take a look at 2 other videos that I did. One was on the quadratus lumborum muscles, and the other one was on pelvic tilt. They may also be applicable to you. But yeah, that's really it for today. So any questions, do feel free to comment down below, or you can contact me through my Facebook or Instagram and I will answer you. You can subscribe to my channel. There will be numerous more posts coming, particularly on sporting injuries. I realise I've done a lot of medical stuff at the moment, so there will be a lot more sports injuries and posts about specific muscle groups and sort of what causes them, what you can do about them. So keep an eye out for those. But yeah, that's it from me today. So take care, and I will see you next time. Bye.